The ambition, therefore, needs to be broader than more centers. It should be better access to appropriate care. Community organizations have a vital role to play. The NHS cannot and should not carry the entire responsibility for improving the nation's mental health alone. Community organizations, charities, counseling services, voluntary sector providers, and social enterprises can play a crucial role alongside statutory services. The strength of a truly integrated mental health system lies in bringing different forms of expertise together. Clinical intervention has its place, so does counseling, so does peer support, so does practical assistance, so does prevention, so does education and mental health literacy. And sometimes what someone needs first is simply a safe place where another human being will listen without judgment. We should welcome the ambition, but hold on to the humanity. We welcome the principle behind these plans. For us, early intervention has never been simply a policy objective. It is fundamental to how we believe mental health support should work. People should not have to wait until their difficulties become a crisis before they are offered meaningful help. However, we should also be realistic. Opening 100 community mental health centers and establishing 59 additional mental health A&Es will not by itself solve England's mental health challenges. The real test will be what happens inside those buildings. Will people be listened to? Will they receive timely support? Will professionals have the resources they need? Will services communicate with one another? Will people receive continuing support after the immediate crisis has passed? And perhaps most importantly, will the system recognize the person behind the diagnosis, referral, or crisis? Because mental health care is ultimately about people. It is about the teenager who is frightened to tell anyone how they are feeling, the parent who is quietly struggling, the worker who is barely holding things together, the person who has been waiting months for help, and the individual who has finally reached the point where they simply cannot cope anymore. Bringing mental health support into our communities could be a significant step towards ensuring that these people are seen before they disappear into crisis. But we must make sure that the ambition is matched by investment, workforce capacity, clinical governance, compassion, and continuity of care. The door to mental health care should not only open when someone reaches breaking point. It should be open earlier. It should be visible. It should be welcoming. And it should lead to real, meaningful support. The proposed community hubs could help England move closer to that vision. Now the challenge